Hey friends, I'm Dr. Molly Brinkman. I'm a small animal veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. Welcome to the Dr. Molly Says podcast. Hi, everybody. Today we are covering a medical topic. We're going to talk about the pancreas. It's a very cool, very small organ in the body. Humans have it, dogs and cats have it too, and we're going to talk about it. Before we do that, I don't have necessarily a hot take over hot tea, but I do have some information I want to share with you. So I just wanted to sort of make a public service announcement. There's some news or word coming out in the veterinary field about an issue happening in cats. So if you've never heard of the drug Apoquel, it's what's called a JAK inhibitor, and it's used commonly in dogs to manage allergies and what we call atopy. And I've talked about Apoquel on the podcast before, and I talked about allergies, and Apoquel is a very commonly prescribed drug in veterinary medicine. So a lot of households have it if they have dogs. Recently, there has been a new kind of Apoquel come out that's chewable. So it's a chewable tablet that's flavored, easier to give to some dogs, but we are seeing a new problem because of it in households that have dogs and cats. There are cats who are eating that chewable Apoquel because it tastes good. And so different universities, specialty centers, even GPs are reporting more cases of Apoquel toxicity in cats. And they think it's simply because cats are getting into chewable Apoquel because it tastes good and eating it. And we haven't completely established what dose of Apoquel actually causes an issue in cats. There are actually some dermatologists and other veterinarians who may put certain cats on a lower dose of Apoquel. But there are toxic levels of Apoquel that can harm cats. It's causing kidney failure in a lot of these patients. So we're just trying to spread the word. If you have a dog that's on chewable Apoquel, make sure you're keeping that in a safe place where your cats or your dogs can't get into it. So just wanted to put that out there, make sure people know about that. I have a lot of colleagues talking about it, as we should. So we want to keep your dogs and your cats safe. So we're going to dive right in the topic today. We're talking about the pancreas. The pancreas is a very small but very mighty organ. It is very important, cannot live without a pancreas. Neither can dogs and cats. And it does a lot of things, a lot of really important things. And I would say the general public probably doesn't know a whole lot about the pancreas. So we're going to talk about it. We're going to talk about two more common issues or two diseases that can arise when the pancreas isn't exactly working correctly. And they happen one in dogs and cats, and one mostly just in dogs. So we're going to jump right in, but I want to explain first a little bit more about what the pancreas is, what it does. So the pancreas is this very thin, sort of friable organ. It's like I said, very thin. It's sort of this beige color, sort of lobulated, and it lives kind of tucked close to the stomach and the intestine. So it sort of just sits, kind of makes an L shape, and just sort of kind of sits in a little warm corner between the stomach and the small intestine. And it can move around, but that's what it looks like. And there are two main jobs that the pancreas performs. One, and they're different sort of parts or cells of the pancreas. So you have the endocrine pancreas and you have the exocrine pancreas. And so the endocrine point of the pancreas is to produce insulin and glucagon. And what insulin and glucagon do are control blood sugar. And so that's a conversation when we talk about diabetes, which we're going to eventually. But the pancreas is really important for insulin regulation and blood sugar regulation. And then the exocrine pancreas is what produces digestive enzymes. And digestive enzymes from the pancreas are very, very important for food digestion. So the exocrine pancreas creates these enzymes that within the intestine break down fat, proteins, carbs, help us digest our food so we can actually absorb nutrients from it. So Without the pancreas, food can't be digested and our blood sugar cannot be regulated. So this is why we need a pancreas and we need a well-functioning pancreas. And when we don't have it, major problems arise. And that is true for dogs and cats when they have a condition called pancreatitis. And if you've never heard of pancreatitis, if you've never heard of pancreatitis, the term pancreatitis just means inflammation of the pancreas. I'm going to teach you a little bit of vet school right now. Any word that's talking about an organ or a part of the body that has itis on the end, that just means that that is inflamed. So pancreatitis just means the pancreas is inflamed. And we see this happen in dogs a lot. Pancreatitis is a very common dog diagnosis and problem. There are some breeds of dogs that we see this more often. If I had a room full of veterinarians and vet techs and I said, what's the first word that comes or dog that comes to mind when I yell pancreatitis? They're all going to yell schnauzer because schnauzers are like the poster children for having pancreatitis, especially miniature schnauzers. So schnauzers, they like sniff butter and they have pancreatitis. Yorkies, Cocker Spaniels, or other breeds we think of, lots of small breed dogs are more likely to have pancreatitis than others. Any dog can develop pancreatitis, and there are different reasons, which we'll get into. Cats can also have pancreatitis. Very true to cats. It's a little bit sneakier in cats. We'll talk about it. But we do think that Siamese cats are more predisposed to pancreatitis than other breeds. So what causes this inflammation, this angry pancreas, as I say to my clients? So in dogs, there are a lot of possible triggers for pancreatitis. The most common is probably going to be eating food that's high in fat. So table scraps that have a lot of fat or butter or other high fat content foods. Some dogs who are obese are more likely to develop pancreatitis. Dogs who have endocrine issues like Cushing's, hypothyroidism, diabetes, which diabetes has a lot to do with the pancreas, which we'll learn about later. And then there are some medications that can also trigger pancreatitis. And that is usually some dogs are just more sensitive than others. And usually, or pretty much all the time, we don't really figure that out until it happens. You can have what's called idiopathic pancreatitis in dogs where we don't really ever determine a real trigger. So that's important for you to know that sometimes we don't know why it happened. I am very convinced that in some dogs, stress can trigger pancreatitis. And so sometimes it just comes out of nowhere. Pancreatitis can happen in any age dog. Dogs who are more prone to it often are going to have a flare up of pancreatitis, I would say, by the age of like 5. But there's no set rule. An old dog can have pancreatitis for the first time. They can start having it pretty young. And in cats, pancreatitis in cats is often a chronic issue. It is often also idiopathic. We usually don't really know the reason for it. Trauma can trigger pancreatitis in cats, infections. It can be part of a condition called triaditis. Remember, itis, which is inflammation of 3 organs, pancreas, liver, and intestine. And so in cats, it's a little bit more complicated. No surprise. But in cats, we see a lot of chronic pancreatitis. So you can have acute pancreatitis. Suddenly, the pancreas is really pissed off. And then you can have chronic where they've either had a bunch of episodes of acute pancreatitis and it's just become sort of this slow burn, chronically inflamed pancreas. And those can be important to differentiate because we can manage them in different ways. So what does it look like in our patients? In dogs, pancreatitis can make them very painful. So we often see dogs who are not eating, they can be vomiting and or having diarrhea. They'll often sort of seem hunched up. That's what owners say to me sometimes, or they'll kind of be stretching or bowing down a lot, just doing weird postures. They can be painful when you touch their abdomen or pick them up. I've had owners come in and say, I think they broke their ribs because every time I pick them up, they yelp. And it's because their cranial abdomen, so their abdomen closer to their rib cage, is uncomfortable because that's where the pancreas lives. And the pancreas gets pissed off and there's inflammation all around it, and that hurts. They can be quite lethargic. And again, a lot of times they don't want to eat. In cats, of course, it's more subtle. It's often chronic. So we'll just kind of see this chronic pattern of decreased appetite, chronic recurrent vomiting. They can lose weight and maybe have sort of transient lethargy, like they're kind of off one day, but then they're better the next day. So when we see a patient with especially or acute pancreatitis, a dog who suddenly has GI upset and is painful, there's some testing we're going to do just in general to try to narrow down what's wrong, right? And we do have some test options if we suspect pancreatitis to give us a clue. So we do have a more specific test now. There's a canine and feline version. So it's called pancreatic lipase immunoreactivity. And this is an objective measurement we can make from the blood, and it's fairly consistent if it's high enough with pancreatitis. We didn't always have this luxury. We used to use what's called a CPL, which basically was a snap test. It's what I had used in the clinic, where if it was high, it could be pancreatitis. And if it wasn't high and it was normal, it probably wasn't pancreatitis. But now with CPLI and FPLI that sometimes we can run in-house or send out, we can more quickly be more convinced that that patient has pancreatitis. And this helps when we're working up a GI case, because there are 50 different reasons why a dog might be vomiting, having diarrhea, not eating, not feeling well. And so this really helps us get to that faster. Ultrasound is another really helpful diagnostic for pancreatitis. It's not always financially feasible for clients. It's not always readily available in a GP practice, but we do see changes on ultrasound that can help us know that the pancreas is mad and that's what's going on. And then we always want to do our due diligence to rule out other causes of those GI symptoms like vomiting and diarrhea. So often your vet might recommend x-rays as well of the abdomen, make sure no sign of a foreign body or something else going on in the abdomen, obviously. So once we've identified dogs, is mostly what I'm talking about, acute pancreatitis. So once we've said, okay, this dog we think has pancreatitis, the mainstay of treatment is we want to support them. These dogs can get really dehydrated really fast. They need fluid support. So a lot of times they're going to need IV fluids. We give them anti-nausea medications if they're vomiting a lot, anti-nausea like Zofran or ondansetron. And if they're vomiting a lot of times we're going to try or give a medication called Cerenia, which will stop vomiting. It's really important that we stop that vomiting, which will help with the dehydration. And then pain control can be a really important part of pancreatitis management. Like I said, some of these dogs are just really painful and some more than others. And so we give opioids even sometimes for pain management. So things like hydromorphone, buprenorphine, different morphine, methadone, different opioids can be given to help control that pain. And they're often going to need to be hospitalized for a day or two. We do a lot of outpatient therapy in our GP clinical setting. So we see a dog for pancreatitis. We give them IV fluids through the day. We give them those supportive meds. And then we send them home for the night and they come back the next day. In our stable patients, that's a very plausible treatment plan. They don't always have to end up in an ER hospital setting. And one thing that has sort of changed over the years in veterinary medicine is that in these patients, it's really recommended and studies show it's better to try to get them eating early on. So we want to support their gut with nutrition, and we want to get them eating a low-fat, highly digestible diet as early on as possible. This is sort of a shift in plan from what veterinarians did, 15 years ago. They would keep these dogs fasted. They would not feed them for several hours to a day or two. But now we sort of shifted. We want to feed them early on. We just want to feed them the right food to help support their gut. I did want to take a minute to talk about a newer drug on the market that we can use when we're managing pancreatitis. This is called Panoquel. That's the brand name. I'm going to say it wrong, but it's fusaplidib sodium. I probably said that wrong. This is an IV injectable medication. What it does is, the point of it is to help dogs with acute pancreatitis and help them feel better sooner. Studies show it can help speed up their recovery and also prevent worsening of the pancreatitis. There is a severe form of pancreatitis called necrotizing pancreatitis. So what happens is the enzymes that the pancreas produces, they get activated in the pancreas. That's what's happening. And so if that sort of compounds and gets really, really worse, the fire is blazing, it can start to actually what we call autolyse the pancreas. So it starts to eat the actual pancreatic tissue, which is like wild. Nature is wild and biology is wild. So that is the most severe form of pancreatitis. That is the most fatal form of pancreatitis. Often acute run-of-the-mill pancreatitis will get worse and become that. Not often, occasionally, but it usually starts as just acute pancreatitis and then it worsens and can become necrotizing pancreatitis. And so Panoquel is a medication, one we give just to help our patients recover faster, but the real intent of that medication was to try to prevent that necrotizing pancreatitis because it helps inhibit white blood cells from all rushing to the pancreas and attacking it. Because the immune system is very, very smart in some ways, but then it's very, very dumb in some ways. And so sometimes the immune system overreacts and it will kind of overattack the pancreas with those white blood cells. And so Panoquel is just a way to help prevent that from happening. This is given in addition to all those other treatments that I said. It doesn't replace those. It's just another tool we have. It isn't the cheapest medication, and so we always think about using it in certain more severe cases, and we weigh the size of the dog. It is dose dependent, so the cost can be more for bigger dogs. At my clinic where I work, we use a good bit of Panoquel, and we've been very, very happy with it. And we definitely think our patients that get it do better. So yeah, that's how we support pancreatitis cases. We want to keep their pain under control. We want to keep them hydrated, rehydrate them if they're dehydrated, stop the vomiting. And then if they have diarrhea, we want to support that. So however we normally support diarrhea is what we do. Occasionally, they may need antibiotics for diarrhea, but usually that's not the case. We're going to support them with antidiarrheals and that very highly digestible, low-fat food. But any other things that we as vets decide we need to do to support a dog with diarrhea, we'll also do in those cases. Dogs with pancreatitis, some just need outpatient treatment, even sometimes subcutaneous fluids. Those treatments, go home, see how they do. And then in more severe cases, they can be hospitalized for days to even weeks. Some of these dogs need feeding tubes. They need a lot of support to stay hydrated and feed the gut and live. So it can be very, very severe. There's a very wide range of clinical severity with pancreatitis. And that's why your vet probably is going to take it very seriously if they diagnose or suspect your dog or cat has pancreatitis. They're going to want to treat it really well early on because they want to prevent that from worsening. And then when we do have a dog with pancreatitis, especially if it's the first time it's ever happened, we look at a lot of different factors. Obviously, we're going to run full blood work. We want to make sure everything else looks okay. Are the kidneys functioning properly? Is the liver working right? How are proteins in the blood? What does everything else look like? We want to get a really good history. What have they been eating? Have they eaten abnormal food, a new food, higher fat food, table scraps? And have they had any medications, anything that's been out of the ordinary lately? Like I said, a lot of times we don't ever figure out why they have pancreatitis, but we want to get a thorough history, we want to figure it out. If it's the first time a dog has had pancreatitis, I definitely talk to owners about going on that low-fat, GI-friendly diet for at least a week or two. Sometimes, depending on sort of the situation, we'll try to transition back to their normal dog food if it's appropriate. And then if they have a recurrence of pancreatitis, then we talk about long-term maintenance on a prescription or formulated, fresh, cooked, or over-the-counter diet that's low in fat. Our prescription diets are really the best for this, or a formulated, fresh cooked diet, homemade diet with a boarded nutritionist, because we really want to get that fat content really low. And it's hard to find that in an over-the-counter food. And like I said, in cats, they more often have chronic pancreatitis. And so we often diagnose cats with pancreatitis once it is chronic. This is often diagnosed by ultrasound. Their pancreas will look bright on an ultrasound, and they will have a history of this chronic disease. And so we often want to figure out, is there something else going on in that cat that's leading to that? And pancreatitis management or prevention is really important. Like I said, some of these dogs, they'll go on, and cats, low fat diets if we think fat was the trigger, and that can help prevent recurrence. And we just really try to figure out what's making them have pancreatitis, keep that from happening. And then it's really important for pet owners who know their pet or their dog or their cat is predisposed to pancreatitis to just really being acutely aware if they skip a meal, if they seem off one day, if they vomit, if they have soft stools. We want to get ahead of it. We want to treat it as soon as we see those signs. Okay, that is like the meat and potatoes of pancreatitis. It can be a very devastating disease. It's frustrating for pet owners because it's hard. They don't really often understand why this happened, and we may not ever figure it out. But prognosis for dogs especially with pancreatitis, if we can treat it well and early on, get them fed, get them nutrition in their gut, a lot of them do really, really well. And then we just manage them and try to prevent it in the future. So the next pancreatic issue we're going to talk about is one of my favorite diseases to diagnose. It doesn't happen very often. It's pretty rare, but it's a cool disease, not cool for the dogs, but it's interesting, I guess I should say. And I've diagnosed it a few times in my career, and every time it's been very rewarding diagnosis. And that condition is called EPI, Exocrine Pancreatic Insufficiency. So EPI is a condition where the pancreas is not producing enough digestive enzymes. So the exocrine part of the pancreas that produces those enzymes to help digest food, it's not working. And so food passes through the gut without being digested properly. And so nutrients are not absorbed the way they should be because they're just not available. In dog, this is really a dog problem. It can happen in cats, interestingly enough. If it happens in cats, it's usually secondary to chronic pancreatitis. So that chronic pancreatitis, that chronic inflammation damages the pancreas. And so then it's not producing those enzymes the way it's supposed to. Interestingly enough, diabetes can also be secondary to chronic pancreatitis. So in dogs, they can have primary or secondary EPI. Primary meaning they just have EPI for a certain reason, which I'm going to tell you, or secondary, they develop EPI because of an underlying condition like chronic pancreatitis. So primary is going to be more common in dogs. This is what we think a genetic sort of immune-mediated condition where the body actually destroys its own exocrine pancreas, or at least part of it. The German Shepherds are the poster children for this disease. So there's some type of genetic link to this in German Shepherds. Other dogs can have it. The first time I ever diagnosed this was actually in my internship. I did some small animal work at my equine internship, and I diagnosed I think that this dog was like a German Shorthair. And no, it was a border collie. I'm sorry. This was a border collie. Interesting case. So this was a young dog, border collie, had been just really thin always. It was probably like 3 years old, and he just kept losing weight. And his owner was frustrated, had been to a couple other vets, and was like, what's wrong with my dog? We had done fecal testing, no parasites, blood work all looked okay, regular blood work, but the dog just kept losing weight. And so I just was asking the owner a lot of questions, and I was like, tell me about his poop. What does his poop look like? Do you notice anything weird? And he told me that the dog's poop, he's like, well, now that you asked me that, his poop kind of looks like his kibble. And I noticed that the magpies love it. So in Colorado, there are magpies there. They're very cool birds. Look them up. And he was like, they eat his poop like it's a delicacy, which was so interesting. So like alarm bells started going off in my head. I was freshly out of vet school. I'm like, oh, maybe this dog has EPI. So we did testing for it, and that dog had EPI. We treated him, which I'm going to tell you what that is in a minute. And he was so much better within just a few short weeks. So it was a very rewarding diagnosis. The owner was like, we're going to end up euthanizing my dog and I'll never know what's wrong with him because he's just wasting away. So I've had a few cases like that over the last 10 years in my career, and they're always very, very rewarding. So, like I said, clinical signs like that dog, there can be a range of clinical signs. Some of these dogs are young and they get very sick very early on. So they don't have good functioning exocrine pancreas from an early age. So they can act like they're starving. They eat, and they just keep losing weight or they can't maintain their weight. They often have abnormal stools. So they can have diarrhea, but they also have what's called steatorrhea, which is greasy stools. So they'll have abnormal, kind of soft. People will say their stool looks greasy, like it has this sort of grease-like film. It can smell really weird or extra gross and have really big stools, and they can look like undigested food, like that border collie. So in that border collie, his food wasn't getting digested, and so that dog poo was in essence like running through his intestines, and so the magpies were like getting free dog kibble in the yard. So funny. But yeah, abnormal stools, losing weight, can't keep their weight on. They can develop poor coat quality. They can have really bad gas. Sometimes they will have actual diarrhea. Sometimes they'll vomit. Sometimes they don't want to eat. But really, these are just unhealthy dogs, and there's not a good reason, and they're losing weight and have weird GI things. The cool thing about EPI is you can diagnose it. It's pretty straightforward with a blood test called TLI, trypsin-like immunoreactivity. This is the gold standard way to diagnose this test. I most commonly send this test to Texas A&M's GI lab. They have a lot of great GI testing at their lab. And so we send out a fasted blood sample. So dog doesn't eat for a few hours. We draw blood, we send it out. And that test measures different levels having to do with the gut. But TLI is on there, and that is going to be elevated in these, Yes, in these dogs. And then the other common co-finding we see in these dogs is that they'll have B12, which is cobalamin deficiencies. And that just kind of goes hand in hand. It's because of this nutrient absorption problem. And so that is, if you run a Texas A&M GI panel, that's included. So we'll see that as well. And so we'll replace B12. We'll put them on a B12 supplement at the same time that we treat the EPI. So just another common issue that goes hand in hand with EPI. So treatment for EPI is also pretty straightforward. Another great thing about this disease. So we literally just give them pancreatic enzymes orally. And so they do the job they're supposed to do. There are a few options for choosing pancreatic enzymes. There's some different ideas of what's best. So you can have, there are powdered forms, veterinary labeled, powdered pancreatic enzymes. Pancrezyme is one. There's a few different options. These are this is what I prefer. They're the most effective. You don't have to worry about absorption. There are some capsule options, but you have to worry about absorption with those. And so I typically am going to just recommend an enzyme powder. And some people want to use raw pancreas. Where do they get the pancreas? Pigs, cows, raw pancreas. This is not a good idea. This is along the same lines as raw food. There's really no reason for this. Dosing is inconsistent because it's hard to know how much enzyme is in a certain amount of literal pancreas from another animal. And then, of course, because it's raw, there's infection risk. So if you've heard about that being an option, there is no science that says it's superior. No data says that. I would avoid that. I would go with a veterinary labeled powdered pancreatic enzyme supplement. It's basically a supplement. And so a lot of these dogs will have an enzyme supplement and also a special diet. At least at the beginning, we consider highly digestible, sometimes low fiber diets, especially when we first start treating them. We're going to also supplement them with B12 if they're B12 deficient. If you didn't know, there are a couple ways we can give B12 to dogs. And cats. There is an injectable form of B12. We usually give that once a week for about 4 weeks. But now we know that oral B12 supplementation is absorbed pretty well. So there's also oral B12 supplementation that dogs and cats can go on. So EPI is a cool diagnosis, and it's great because most of the time we can treat it. These dogs do wonderfully. They bounce back as long as they're on enzymes. They do great. And they do have to be on those enzymes for life. So something important to remember, you're never going to graduate from your dog taking pancreatic enzymes. And they do wonderful. So if you have a German Shepherd, that's the breed. That's the poster child. So if you have a young German Shepherd with those GI issues, if your vet recommends a GI panel, that's one thing that they're gonna want to rule out. One interesting thing, we're almost done, but to add is I read about a case recently. I was actually presenting with Senior Dog Society, and we were doing some older dog interesting cases in a lecture, and an internal medicine vet gave us this case because it's interesting. So this dog was a diabetic, but had like chronic recurring GI issues. And suddenly this dog's blood sugar was difficult to regulate. So it had been like a well-regulated diabetic. And then all of a sudden it was having these big swings in its blood sugar. It was getting too low sometimes. And they couldn't figure out why at first. But turns out the dog had developed EPI because of its chronic pancreatitis, plus it had diabetes. And so the EPI was affecting its blood sugar regulation and making the dog unwell. And so that dog went on enzyme supplementation and did great. So just another interesting thing that can happen if you're in vet med and listening to this. I didn't really know that that was a thing before I learned about that case. So it was a great little pearl for me to think about if I have especially an older dog with diabetes who's been well regulated, has any history of GI signs, and suddenly we're not regulating well. It's definitely something to think about, sitting out a GI panel. Okay, if you're listening, a lot of you that have dogs have had a dog with pancreatitis. So I hope this is helpful. I hope it helps you understand what was and is going on. And if you don't have a dog with pancreatitis yet, but you do in the future, I hope this helps one day. So thank you for being here. We have some great episodes planned coming up in the next few weeks. If you're not following us, be sure to do so on TikTok and Instagram. Our handle is Dr. Molly Says Pod. You can also follow me, Dr. Molly Brinkman, at Dr. Molly Says on all social media platforms. We're also on YouTube. If you're not watching this, you can. And be sure to subscribe. Make sure you're downloading episodes. Leave a review if you want. And if you have questions for me, I'm happy to answer specific questions. So you can DM our Instagram, or at the link in our bio, we have a place to submit questions. I will see you all next week on the Dr. Molly Says podcast.